Hi, my name is Shaunarich, and I am a licensed mental health therapist. I work mostly with pregnant and postpartum people, and I wanted to talk to you just for a couple of minutes today about pregnancy and postpartum and your mental health. So the first thing that I think it's important for you to know is that 80% of people who have a baby in the postpartum time will feel a little bit overwhelmed. They might have the baby blues, as it's called, as their hormones regulate. And what that means is that you might feel a little bit weepy, kind of overwhelmed, maybe cry a lot, and a little bit anxious. And that happens to most moms because you're going through a really big transition. So it's important to remember that that's normal for the first couple of weeks. If this keeps happening and you're still, maybe at week 4 or 5, still feeling totally overwhelmed, you're still crying, you feel really anxious or nervous, maybe you're sort of ragey, kind of angry, or you're having scary thoughts, which is really common. Maybe some guilt, shame, or regret is creeping in. This is when we want to talk to somebody about the possibility of postpartum depression or postpartum anxiety. 1 in 7 people who have a baby will experience that. And while we call it postpartum depression or postpartum anxiety, this can happen while you're pregnant too. A lot of people say, well, how do I know that I need to seek help? Well, the way that you know you need to seek help is if it's interfering with your daily life, right? So if it becomes intrusive, if it becomes something that's preventing you from moving about your day and getting things done and taking care of yourself or your baby or the rest of your family or going to work, this is when we want to talk to somebody about it. And again, it is really common, 1 in 7 women, and it's also really treatable. So you don't have to take medication, but it can be helpful to take medication. Sometimes just short-term therapy is helpful. Sometimes you just need a little bit more sleep. Sometimes you just need a little bit more help. So it's good to remember that if you're feeling this way, that it is okay to tell somebody that you're certainly not alone and that it is treatable. Postpartum depression gets a bad rap. I think a lot of people hear that phrase and they think, oh, I can't have postpartum depression because I don't want to hurt myself or I don't want to hurt my baby. But that's not always what it is. Sometimes postpartum depression or postpartum anxiety looks like having scary thoughts about something or just feeling totally overwhelmed or angry. So there's lots of ways that postpartum depression can look, and it does not look like you want to hurt yourself or your baby. That is a totally different thing. And of course, if you ever do feel like you want to hurt yourself or you want to hurt your baby, then that is also an emergency and we'll need to seek help for that. Some of the prevention for this, for postpartum depression or anxiety, is some of the things that I mentioned a few minutes ago. Just seeing if you can enlist a little bit more help if that's an option for you, whether it's family or friends or neighbors or somebody from your church. Getting a little more sleep, making sure that you're eating enough, that you are getting, hydrated enough. These things can all contribute to not feeling well emotionally. So what are you going to do? You start to notice that you are overwhelmed, you are kind of angry, your thoughts are scaring you, you just don't feel like yourself. What should you do? Well, the first thing you should do is tell somebody, because remember, you're not alone. This happens to a lot of people. And if you feel like it's time to seek help, then do so. And some of the people that you can go to will be your doctor, so your family doctor or your OB/GYN or your midwife. You can also reach out to me, and I'm going to put in the video, I'm going to put my information down here, and I'm also going to put the hotline number. So there's a free hotline that you can call, and one is an emergency hotline. So if you feel like you need immediate help, you can call that hotline. Of course, if it's an emergency such as you're going to hurt yourself or you feel like you might want to hurt your baby, that's more like an emergency room visit, not a phone call. But I'm going to put the information under here. So reach out, tell somebody, because it's not typically very long after you start telling somebody before you start feeling better. And what you might find is when you tell somebody how you're feeling, whether it's your doctor or your mom or your friend, you're going to probably find that you're not the only one that felt that way. A lot of people have been in your shoes and they're going to relate. This transition from not being pregnant to being pregnant, or from being pregnant to being a parent, is really hard. And sometimes we just need some help. So the resources are going to be down here, and I encourage you to check them out. Look at them. If you're watching this while you're pregnant, I encourage you to write down the hotline number and just stick it on your fridge or on your desk or somewhere that it's easily accessible for you if you feel like you need it. That way you don't have to dig around and find this video. And I think another important thing to remember is if you do reach out for help, I know that there is a stigma or some myths surrounding it. If you tell somebody that you have postpartum depression, or you tell somebody that you have postpartum anxiety, or even if you tell somebody that, you're having really scary thoughts, this doesn't mean they're going to take your baby away from you. And I think as a mom, I understand that that's a really scary thought and that is a big worry, but that's not the case. So when you go to tell somebody, their priority is going to be to keep you safe and to keep your baby safe. And that doesn't mean that they're going to take your baby away from you. It means that they're going to get you help. So again, resources down here. If you have any questions, you can certainly reach out and contact me. And if you feel like you ever need a mental health therapist surrounding pregnancy or postpartum, I'm your gal. And if I'm not your gal, then I will help you find somebody that's perfect for you. So again, my name is Shaunarich, and I am a licensed mental health therapist. I specialize in pregnancy and postpartum. Thanks for watching.